Deploying to a war zone once is difficult enough, but many service members have endured multiple deployments. Surviving the experience of war is often accompanied by negative side effects. Some service members find ways to adjust in a healthy way, using positive outlets with support from family, loved ones, and friends. Other service members adjust through drugs, alcohol, or behavior that is detrimental to their loved ones and society. Often, war veterans come home with wounds that are invisible to the eye. Imagine being deployed to a combat zone, unsure if you or your fellow soldiers will live to see the end of the day or night. Hearing gunshots and mortars, never knowing if there is an IED when you're trying to cross the street, if the child in front of you is innocent or part of a plot to kill you. These are some of the traumatic experiences that have left service members with a condition called post-traumatic stress disorder, PTSD. According to military statistics, between 2000 and 2012, an estimated 131,000 troops have been diagnosed with combat-related PTSD. The medical definition is a psychological reaction that occurs after experiencing a highly stressful event, outside the range of normal human experience, and that is usually characterized by depression, anxiety, flashbacks, recurrent nightmares, and avoidance of reminders of the event. Having stress-related actions is common after experiencing such an event, but if the reactions do not go away over time and become worse, an individual may be experiencing PTSD. Warning signs might include nightmares or flashbacks, poor anger management, emotional numbness, avoiding crowded or unfamiliar situations, hypervigilance, and overreaction to common things in civilian life that cause you to relive past experiences with the same feelings of fear, anxiety, or reaction. There are many symptoms of combat PTSD that can disrupt a service member's life and reintegration back into society. Through the 17 years of research, symptoms have been identified and have been separated into clusters. Avoidance and emotional numbing symptoms may include avoiding thoughts about past events, feeling empty or detached from the world around you, loss of interest in activities that were once enjoyed, feeling hopeless about your future, memory problems, trouble concentrating, and difficulty maintaining close relationships. Some individuals keep busy and avoid seeking treatment or care. Hyperarousal symptoms may include trouble falling asleep, staying asleep, irritability, and being easily startled. A person can feel tense, anxious, or afraid, on alert as if back in combat. Able to go from relaxed to extremely aggressive in seconds. There are different types of help, which include individual counseling, group counseling, as well as medications that are used for treatment. Effectiveness may vary greatly due to the complexity of the symptoms one may exhibit. Exposure therapy helps people face and control their fear. The therapist guides them through the trauma they experience in a safe way, using mental imagery and discussion, recalling the events and memories to face them in a controlled environment. The service member will talk about the trauma to the therapist repeatedly until the memories are no longer upsetting. Cognitive restructuring helps service members make sense of the bad memories. The therapist helps people with PTSD look at what happened in a realistic way. In cognitive restructuring, the individual learns proper coping techniques, retraining their brain to overcome depression, anxiety, mental and emotional symptoms with self-dialogue, addressing anger, and relaxation techniques. The VA estimates that 22 soldiers commit suicide a day. Post-traumatic stress disorder is a real illness that affects the lives of the service member, their loved ones, their comrades, and society. Invisible wounds can run deep and get deeper without proper healing, help, therapy, time, support, and encouragement from others. It is estimated that 1 in 3 returning troops are being diagnosed with combat PTSD. Less than 40% will seek help, and less than 50% of those will not seek treatment. Just as diligently as we recruit and train the war fighters of America, we must seek and retrain military veterans that need help finding their old glory. After the helmets are removed, the rifles shelved, and the boots retired, it may seem like it's over, but for some it's not.
Denzel. There you go.